Hi, everyone. Can you hear me? Okay. Hi, everyone. Thank you so much for joining us this evening. This has certainly been a difficult week for our entire country. And although the challenges often feel great, I feel fortunate that we can come together tonight to discuss a much lighter topic and one that we all agree upon, making our kids happy and creating a fun summer for everyone. I am Maren Karosha, Manager of Women's Outreach at Jewish Federation of Northern New Jersey. Before I introduce our guests, allow me to take a moment to share with you a bit about Jewish Federation. The mission of Jewish Federation is to build and sustain a strong Jewish community. We do that through partnering with many frontline agencies that serve vulnerable populations, including seniors, children, and adults with disabilities, and families in need. In addition, we work very hard to build Jewish identity in young people and young families. Many of you receive PJ Library books or When on Birthright yourselves or partnered or participated in Shalom Baby events with me. All those are programs funded by Jewish Federation. And now, during this terrible COVID-19 pandemic, Federation is offering a robust calendar of online events to bring the community together. Today's program is so timely. With all of us unsure about camp, summer programs, and daycare, many of us are thinking, what will the summer look like? Tonight's experts can shed some light on this. I am proud to call them both close friends. Thank you to Dr. Sarah Lupu of Chestnut Ridge Pediatrics in Woodcliff Lake and Dr. Allison Shale Deutsch of Shale Psychology in Saddle River for joining us tonight. In addition to Doctors Shale and Lupu, a warm welcome to Dr. Jessica DiGaetano, also a clinical psychologist, who will moderate tonight's presentation and Q&A.
So much for joining us. Just to give you a little bit of the lay of the land, Dr. Shale and Lupu will present for about 15-20 minutes each, or total actually I should say, on some timely issues that we've been sitting with over the last few weeks or even months now. And then they'll answer questions that have been previously sent in prior to this evening's event and that are being sent in live right now. So if you have any questions, please feel free to submit the questions below. Using the question and answer feature at the bottom of your screen. We will do our best to get as many questions in as we can. Of course, time being a constraint, we will do our best to hit the topics of most concerns to parents. So without further ado, I'd like to toss the program over to Dr. Lupu to get things started.
Sorry about that. I was muted. Thank you, Jessica, and thank you, Maren, for Dr. DiGaetano for introducing and hosting this program. And without further ado, I'll just talk about some things that you guys are all here for. So in many ways, this summer is unprecedented. And while it's very different than what we've had before, it's also very the same. And the way that it's different is, with solutions and the resources that we have to access them. So what are our kids going to be doing this summer? We just heard that day camps might be open. We just heard that daycares are opening, but a lot of us are hesitant to send our kids to those programs. So a lot of kids will be playing in the backyard, going on walks, bike rides, and the like. So I'm going to talk about a bunch of things that can happen in our backyard and how to deal with it and when to reach out to people like me or your doctor. The overarching theme for all of this is if you're ever concerned about something medical, I know I am, and I'm sure every pediatrician is more than happy to answer any questions that you guys have. And with telemedicine being as big as it is, we can also help you out in a much easier way than previously thought. So first, I'm going to give a little brief discussion on COVID, even though that's obviously the elephant in the room. A lot is still unknown, which seems crazy given that it's been 3 months already. We are in most states starting to do a phased reopening, and in Jersey, for example, we're going into phase 2 on 6/22. What I'm getting a lot in my practice are people asking about play dates, people asking about grandparents, when can they hug each other? And my message to all of you is talk to your pediatrician. Everybody's situation is very different, and what might be an easier thing for you is going to be more difficult for other people. So you want to keep in mind risks of your family, underlying medical conditions for either you guys or grandparents, underlying conditions for your children even. Do they have other issues that if they're sick, that could not be a great thing? So talk to your pediatrician. I get this question all the time, and with each family, you know, we try to come to a solution that makes the most sense. A lot of patients are asking about the infamous antibody testing, and what I'm just telling my patients and I'm telling you guys is we don't know enough about what the antibody test means to make any decisions based on play dates and grandparents and daycare based on that. So I wouldn't rush to get it at this moment, and let's see what we learn over the next month or so. So now I'm going to go on to the common things that happen in our backyard and some quick and easy tips on how to treat them and when to call us if you need to. So the first things are those little critters that fly around and annoy us, bug bites. There are several different kinds of bug bites and interactions and things that afflict us. So the first one and the most annoying for me is mosquito bites. I hate them. They're annoying. They're itchy. I get super swollen. A lot of people do. They're not dangerous in their own right, but as I said, they're annoying or itchy. So a lot of parents get concerned because for some kids, they can get very swollen. And then we get concerned, is it an infection or is it just what we call a large local reaction? So that would be something that you certainly would want to call your pediatrician about. You could start with telemed, take a picture right away, because you can, if your pediatrician has a portal or is willing to use text message, you could certainly let the pediatrician see it in that way and then do a telemed. So if you don't feel comfortable coming into the office, that's a really good way to deal with it. In terms of the itching, some quick things that I like to do: cool, wet compresses applied to the bite are very helpful in decreasing swelling and then also decreasing itching. And then hydrocortisone, the regular over-the-counter 1%. It doesn't have to be baby, it doesn't have to be adult, it doesn't have to be brand name. You just put it on the bite twice a day, and within a couple of days, the itching gets much better. Of course, a lot of our kids get very annoyed by these itches and cry and scream. And if you want, you can also use oral antihistamines such as Zyrtec, Allegra, Claritin, and their generic counterparts, or Benadryl as well. Although you have to remember that sometimes Benadryl can cause drowsiness, so you want to be careful about when you're using it. And so I talked about the large local reaction, but one of the things we watch for with mosquito bites is super infection. What that means is that there's a bacterial infection on top of this mosquito bite, and that usually comes from kids just scratching too darn much. What that will look like is very deep, angry red. It will get swollen. Sometimes you might see the red sort of streaking up the arm, and it'll feel hard and warm to touch. So those are signs that there might be infection, and that would be a reason to talk to your pediatrician. You could certainly try topical bacitracin, but a lot of times if it does start to streak like what I'm saying, usually you need some oral antibiotics. So if you're noticing that, I certainly would reach out to your pediatrician. The next thing that is very prevalent in this area specifically is tick bites. We have deer everywhere. I live in Rivervale, and they're in my backyard all the time. And with deer come ticks. So ticks are these creatures, these little bugs that can attach very, very tightly to kids and to anyone really. And the reason it's a big hot button topic is because they can transmit something called Lyme disease, which I'm sure most of you have heard of. So most parents say, there's a tick in my child, what do we do? So what I always tell my parents to do is I say, YouTube how to remove a tick, because 9 times out of 10 people are doing it incorrectly. You do not want to grab the tick body. You want to grab underneath the body to be able to pull it up, and you don't want to squeeze the body of the tick. It's hard to say just over a telephone if it's dog versus deer. Deer tick is the one that transmits Lyme. Dog does not, but I think in this area, it's safe to say it's usually a deer tick, and I would treat it as such. So what I've been telling my patients is if you check your kid's skin every day or every other day for tick bites, then you're in a good spot. The reason being, if a tick stays on for longer than 48 to 72 hours, that is when the Lyme disease can get transmitted. If it's less than that, the likelihood of transmission is very, very low. If it's been on for you don't know how long of a time, then you call your pediatrician and you talk about it further. There are a few options depending on the patient's age. We sometimes just, take it out and wait a month and do testing to see if there is Lyme disease. Or if it's been longer than 48 to 72 hours and the kids are older, we can do a prophylactic antibiotic dose. So that means a dose to prevent the developing of Lyme. So that's something that you would talk to your pediatrician about. So yeah, I think if you check your kid's skin daily, then you're really in a good spot because it's never going to be on that long. Now, is it possible to get Lyme disease even if it's been shorter? Certainly. And if you find a tick, it's something that you definitely want to keep in mind should your child have a prolonged fever, headaches, joint pains, or anything following that. And we can easily do a test at that point. But for the most part, if it's been under 48 hours, you're in a good spot. And then the last thing I just want to quickly mention is bees, bee stings, hornets, the like. They're just painful and not fun, and kids get very upset about them. So what you want to do if you have a bee sting is make sure you take the stinger out, and then you want to apply cool compress as well on that. You can give pain control such as Motrin, Advil, Tylenol, something like that for pain, and then see what happens. If it usually does get very swollen. So if you notice that, don't get overly alarmed. Although if you get swelling in other parts of the body or trouble breathing, that could be a sign of an allergy. And you want to definitely call your pediatrician. But if there is trouble breathing, you want to call 911 as well. So those are the little critters in the backyard that I personally hate myself. So the next thing I usually talk about is scrapes. Kids fall, there's a lot of bike riding. We all play on the sidewalk or in our driveway, and they can fall and get scrapes and bumps and bruises. So the first thing that you want to do when your child is fallen and there's bleeding is you want to clean it with a cool washcloth, and you want to put on some alcohol or peroxide just to clean it off and see what you're dealing with. A lot of times you just have an abrasion, and for that, you just cover it with a clean bandage, maybe some bacitracin, and call it a day. If you think that there's a linear cut that could need stitches, then that's a reason to call the pediatrician. I usually, in the past, I would just send people either to an urgent care or the ER to get repair or come to us so we can take a look at it. But right now, given COVID and so many of you want to stay out of the doctor's offices, I think it's fair to give us a call. You can take a picture, you can telemed, and we can tell you, does it look like something that needs to be stitched, or can that just be treated with bacitracin and a bandage? So with healing, even with stitches or without, you want to assess for infection while it's healing. And the infection will look similar to what the infected mosquito bites would look like. So you'll see a lot of deep, angry red around the cut. You might even see some yellow or green pus, and you might see the redness streaking up. If you notice that, you certainly want to call one of us, call your pediatrician, and see if there's anything that needs to be done further, or if that's just normal wound healing. Fever and worsening pain is also another sign. If there are other injuries like bone injuries, things like that, certainly call the pediatrician. I know at our practice, we're bringing those kids in during, clean hours, just because they're not necessarily showing signs or symptoms that could be considered infectious, and we can take a look at that. So I certainly, if you're concerned about fracture or anything like that, I would say reach out to your pediatrician. And then the last thing that I want to talk about, just that's very timely for the summer, and we all love it, is the sun. I'm very happy it's back out, and I could not be happier, but it is horrible for our skin if we go unprotected. So I'm just going to go over a few things just to help you guys stay protected. So the most important thing, and I cannot stress this enough, is sunscreen. Sunscreen is our bodies is a very good way to protect our skin from getting irritated by the UVA and UVB rays, and can prevent skin damage and possibly skin cancer later in life. There are two kinds of sunscreen. There's chemical sunscreen, which is what we probably all use, and that has different chemicals in it. And then there's also barrier sunscreen, which has zinc oxide and other things that just, it does what it sounds like. It creates a barrier between the sun and your skin so you don't get that sunburn. We generally recommend using a barrier cream with most of our kids because the chemical creams can be absorbed by the skin and potentially into the bloodstream. So I would look for a sunblock that has barrier, zinc oxide, barrier cream, something like that. I will warn you, those are the ones that are very difficult to wipe in. So your kids might look a little pale or ghost-like, but it pales in comparison to getting a sunburn and having to listen to your child complain about the pain. So I certainly recommend that. We recommend the sunscreen over 6 months of age, just because under 6 months, their skin is so fragile and we don't want any absorption. So what do we do for the kids 6 months of age and younger? So for them, it's mostly about staying out of the sun and using other physical barriers. So that would be UV protective clothing. They make really thin, light clothing that you can put on that's long sleeve, long pants or shorts, and you can have them in that. Using a hat that covers their face is also very useful. And then just keeping them out of the sun when the UV index is particularly high. So that's generally between 10 p.m. and 2 a.m., 10 a.m. and 2 p.m. Sorry about that. Now I recognize that that's difficult when you're at the beach. You're not going to go inside for 4 hours, and that's usually the time when it's the nicest. So using a nice little pop-up tent or keeping them in the shade that way is also very useful. And obviously you want to make sure everybody stays well hydrated. Now for the older kids with the sunscreen, how do we apply? You want to make sure you apply 30 minutes before going outside. So I usually tell people to apply while they're getting dressed and putting on their bathing suit for many reasons. If you put it on before the bathing suit, you're not going to miss those barriers that we often miss and get annoying little sunburns like, and then it allows 30 minutes for that sunblock to absorb. You want to reapply, and this is going to be unpopular, you want to reapply every 2 hours, and if there's any prolonged water contact. And yes, I think that's it. So that's a little bit about what this summer is going to look like. And it's not all that different, but it is somewhat different than previous. If you have any other concerns, rashes, fevers, things like that, the pediatricians we're all here to help you guys. So don't be worried about giving us a call. And that's it. I'm going to pass it over to Dr. Shale.
Great. Thanks so much for all of that information. I know I found it really helpful. I'm sure everyone else did as well. Before I get into talking about sleep and screens and some of that information based off of questions that were asked, I did just want to comment on, in light of everything that's kind of going on in the world right now, it would take more than this hour for us to really do justice to so many of the topics that are in our awareness right now: racism, diversity, inclusion, teaching our children empathy. And fortunately, there's lots of organizations and professionals who are starting to put things together to appropriately address these issues. And so I'll encourage you to look for books and websites that can help you start to have those conversations with your children as we as professionals kind of figure out the best way to get all of you information on these topics as it's evolving. Okay, so now back to the other stuff. So sleep and screens. Similar to what Dr. Lupu was saying, a lot of what I'm going to talk about is similar to what I would be saying to families if we weren't in this COVID state. The most important thing with any sort of behavior change that you are trying to create with your children is being consistent and being realistic. And I think right now in this state, being realistic is a really, really important piece. We have made a lot of allowances for our children. We've had to shift our expectations of them in a lot of ways, and we haven't really done that for ourselves as parents. And in a lot of ways, we've upped what we expect of ourselves to be on 24 hours a day, whether that's as a parent, as an employee, as a teacher. And so I really think that it is important above all else that you remember to be kind to yourself. And that's something that I'm constantly talking to parents about. It's really, really easy to get caught in a social media world where you feel like everyone else is doing it better than you. And again, while that's a message that I'm always preaching to parents, I think it's even more pronounced right now when we are in our homes all the time, spending more time on our screens as adults as well, that it is really important that you remember to be kind to yourself in what you expect of you and your children. So in talking about sleep, sleep is something that I talk to every family about when they come and they see me, because we know that sleep impacts your mental health, your physical health, and your immunity. And so right now in this state of COVID, these things are even more important. And because we are at home so much, this is actually a really, really great time to get some healthy sleep habits in. If for nothing else, you probably have a lot more control over your child's schedule now than you did before. So maybe there are fewer caregivers, maybe you're not having to commute to work anymore. There's probably fewer car rides and napping on the go. Siblings and even younger kids don't have as many activities, external reasons that might make us keep our kids up later than they really should be. So healthy habits really means the same thing, regardless of how old your kids are, even if they look a little bit different. So getting enough sleep, sleeping independently, and sleeping through the night are really the three most important sleep skills that we want our children to have. Now, how we get there may look a little bit different based on how old your child is, but it also may look a little bit different just based on who your child is and who you are and what your comfort is. So the other thing that's really important to remember is that what works with one family, or even what works with one child within your family, may not work for the other person. So in some families, they can do more of like a formal sleep training when their kids were really little and they let them cry it out, where other parents just can't do that. Some people really like okay to wake clocks, and other families don't find them as helpful. I do a lot of reward systems and even something called overnight tickets, where we incentivize the child to only come out of their room a set amount of time so that they can earn some prizes overnight, the longer that they're able to stay in bed. Again, though, the end goal is the same, right? That our children get the sleep that they need so that they can function at their best. And while every kid is different, there are some general pieces of sleep work that I think are really, really important. So the first thing is, if you're going to try to change anything about your child's sleep, they can't be overtired. And the only way to keep them well rested is to get them to bed at a good time consistently. What consistently means is not that 365 days a year they go to bed at the exact same time and fall asleep at the exact same time. But what you really want is to see no more than an hour difference between weekdays and weekends in terms of when they go to sleep and even when they wake up. Now, that being said, there's lots of exceptions, right? So outside of quarantine, I often had parents say, well, I don't get home until this time, and then by the time we make dinner and do a bath, and it just isn't possible. And I totally understand that. But again, now we have some luxury with that, and so I'm really encouraging people to get their kids to bed earlier. So I recommend 8 p.m. for our little guys, like preschool age, no later than 8, and no later than 9 for school age kids. Once you get into later middle school and high school, there's definitely more of a negotiation with them than as strict as you can be with like your 4-year-old. And when you're trying to set a good sleep schedule, you often need to work backwards a little bit and make sure that you can get everything in before it's time for bed. That's where a schedule may help you. So again, in this COVID world that we're in, lots of people are talking about schedules and how much should I schedule, and should I block out every 30 minutes, and do I constantly need to entertain my child, and should they be getting more education than they're getting? I think that the best schedule is one that creates some structure for your family without creating added stress for you. So if you find it beneficial to schedule out every 30 minutes and know that your child always has something to do, then you should absolutely do that. But if after the first 30 minutes goes by and your child doesn't want to switch activities and you're then angry for the rest of the day, then a schedule isn't worth it. I actually really like to look at schedules by anchor points. And an anchor point is really just a set time of day where a certain activity pretty much happens every day. So things like meals and nap time. My son has a Zoom every morning at 10 a.m. So that's an anchor for our house. And in between those anchor points, you're going to be able to set some small goals of what you want to see happen. So maybe between breakfast and that 10 a.m. morning meeting, we're going to set a goal of getting dressed, brushing teeth, playing outside, and making sure our project or whatever it is that's needed is done for the Zoom at 10 a.m. So we've only listed a couple of things to get done in like an hour and a half or 2 hours time. So I feel pretty confident we'll be able to do it. So we'll start the day in a positive way. Everyone's anchors are going to look different, and what we set as our goals in between the anchors is going to be different. The only time of day, though, that I think is really important for you to not vary what you do is that time after dinner and before bed. So that time may look different in my house than your house in terms of what they do after dinner. Do they play? Do they take a bath and start to wind down? But regardless of what that nighttime routine looks like, I think it's really important that people are not on screens for that last hour before bed. There's so much talk right now about blue lights, and our children are spending a lot of time staring at screens, and the blue lights just make it a little bit harder for kids to calm down, get the rest they need, let their brain shut off. So if you can, that last hour before bed should really be spent doing something besides staring at a computer or staring at a phone or a tablet. So with that idea in mind, obviously screens are something that is a particularly hot topic right now. Obviously, there's been a lot of talk over the last several years about how much screen time children should have, and there's lots of different recommendations based on how old children are. Right now, though, in this state of quarantine where so many activities are pulled and our children are more limited in what they can do, I'm really talking a lot more about quality over quantity. So rather than telling you that I think your child at 5 years old should watch X hours of television a day, I want to give you some general things to be mindful of with screens in quarantine. I really want parents to feel like they can achieve the goals that they set for themselves and for their families. So when we start to get into your child should watch exactly 1 hour of television, if on a day someone watches 90 minutes, a lot of parents end up feeling really, really guilty about it. And usually there's a reason why there was more screens one day than another. And so I think, again, in that idea of being kind to yourself, I want you to really pay more attention to the quality of what they're watching instead of the quantity. So a couple of other general things to be aware of. Shows that our children watch on television are much easier to stop than watching on an iPad or a tablet, and there's less blue light. So we all know as adults how easy it is to endlessly click through things on social media or YouTube, and it's that endless loop and time just passes without any awareness. There's that piece, and then obviously the safety piece, right? If our child is sitting with an iPad glued right up to them with headphones on, we really have no clue what they're seeing. And it's not necessarily they're going to stumble on something so terrible, although they might, but they might come across a show that you just don't want them watching. Another tip is, especially with the little kids, you should be in charge of the remote, not them. This is something that I think is really, really important for our preschoolers and for our early elementary aged kids, for them to know that the remote is just one of those things that's only for a parent to touch. That means you get to pick what goes on, you get to pick when it goes off. There's no changing channels, there's no rewinding, there's no picking something else. Again, it might sound a little bit weird and like something that you can't really see happening in your house, but it really is helpful in being in control of what your children are consuming. Again, obviously easier for little kids, not something you're going to do with your 15-year-old. The other thing that I think is important with screens is that screens should be earned. So a lot of times screens and TV have become this given or an expectation. And even if you're going to allow a lot of screen time right now, you can have contingencies on how they access it, right? So you might have it so that your child has to stay in bed in the morning and then they can watch a show. It can be keeping your hands to yourself. It can be getting all your schoolwork done. You can have set times of day, maybe when you cook dinner, that you always let your child watch something then so you can get it done. But the most important thing is that you are consistent. So if you say you only get a show if you do X, Y, and Z, then that's the only time they should get a show. You shouldn't cave just because that really confuses our kids and it lets them think that the rules don't always have to be in effect. With everything, being too strict really sets you up for failure. So it is really unlikely right now to say that your child will have no screen time or no access to any screens at all. And when we set that kind of stringent standard, again, we often end up disappointing ourselves when we realize that we need our child to watch something or to be on a screen so that we can do other things. And that's okay. It's really easy to put on a show and walk away. You don't have to feel like you have to sit there and watch every second. But again, that's where some of these rules are really important, right? We want you to be aware of the quality of what they're watching. Controlling the remote, having it on a TV so that you can hear what's being seen. Those are things that can really help you to feel like you're still in control of what's going on while also giving your child some of what they want and we need. Overall, it's really just about being mindful about what you're showing them, how you're getting it, and just remembering that you ultimately are in control of what they can see. And again, our older middle school, high schoolers, we can't control quite as much when they have cell phones and things like that. But for our younger kids where we still can, it's really, really important. So those are some of my biggest tips and tricks about sleep and screens. So I'll pass it back to Dr. DeGaetano, who will start us with some of the questions.
There we go. Thank you guys. Thank you, Drs. Lupu and Dr. Shale, for your information. That was wonderful. And we hope that our audience found that informative. I'd like to transition now to some questions that were submitted before the event and also during the event. So this one, these two, I'm going to combine these, are for Dr. Lupu. Dr. Lupu, with regards to both ticks and splinters. With tick bites, if we don't see a tick on the child's skin, is there a way to tell if they were bitten by a tick? And also, how do you deal with splinters?
Okay, so good question, both of them. So for the ticks, oftentimes we don't know. There is that classic bullseye lesion that everybody reads about, but we don't always get that with tick bites. If you do see a red circle that just seems to be expanding, that is a sign of a tick bite, but sometimes we don't know. And that's why, given the area that we're living in, if I, as a pediatrician, encounter some signs that could be considered Lyme, then I generally do testing just to make sure. If we were living in New Mexico where there are no ticks, I don't think they think about it, but we're very vigilant about it here. In terms of splinters, they're the most annoying things. That's very difficult. If part of it is on the outside, you want to use some clean tweezers just to sort of see if you can inch it out. You can also use a little sewing needle just to see that you burn a little bit, just to make sure it's sterile. And then you see if you can sort of inch it out that way. But if it's deep enough that you really think you need a needle or something like that, give us a call and we'll be able to take care of it in the office. I do it a lot. And that way we can use sterile instruments and we don't risk getting infections by trying to do it at home.
Great, thank you. This question might be more for Dr. Shale, but Dr. Lupu, certainly feel free to jump in. Everything I say to my daughter is a starting point for her to negotiate to get her way. Any tips for how to deal with a strong-willed 4-year-old, or any age for that matter, who can't seem to listen if it's not exactly what she wants to hear?
Well, I can relate to this, definitely, with my own 4-year-old at home. So first of all, I think it's really important to just know that it really is very normal. This is definitely the age where children are trying to figure out what they can control. And so I tell parents a lot that it's really great if you can give your children choices. So anytime that you can give them two choices that you are obviously picking, right? We're not giving them a choice of, do you want to go to bed or stay up and watch TV? But maybe we're saying, do you want to brush your teeth or do you want to read a book first before you go to bed? So it's giving your children choices of things that you are okay with. The other thing that's really important is being really consistent and follow through on the things you say. So sometimes when kids fight back, it's because they've learned that, well, last time you said you were going to take that away and you didn't. And even at 4 years old, they can notice those patterns. So you don't want to make an empty threat. You want to follow through on everything you say you're going to do. And probably the last thing would be something that I love, which is active ignoring. So active ignoring is when you ignore your child's negative behaviors while you are actively looking for something positive that they're doing that you can then give some attention to. So if your child's throwing a tantrum, maybe you're just looking away, continuing whatever you're doing. As soon as they even take a breath and kind of pause for a moment, you're going to redirect your attention to them and point out how proud you are that they calm down, that it's so much easier to understand them when they're not screaming, because we really want to show them that the way to get attention from you is for the good stuff and not the bad stuff. So just hang on, because 4 is hard. So, but you'll get through it. You'll be okay. You'll get through it. We all do.
I think I would second that one, Dr. Shale, as well, with my own 5-year-old at home. It gets a little better at 5, a little. But just hang in there for 4. Here's actually a great question. Again, I think that we can have both the psychological and also the medical perspective as well. What would you suggest saying to our children if we aren't sending them to camp because we aren't comfortable, but their friends are going?
Do you want me to start or you want to start, Dr. Lupu?
I think you can start with this.
Okay. So, I've had lots of people ask about this, not just about camp, but also just in general, as restrictions loosen, every family is responding to these restrictions differently. Some people are spending time with family. Some people are not going to the supermarket. Some people are having play dates. Some people aren't. And I think right now is just really good practice for everything like this, right? So we're going to have a lot of opportunities and a lot of times where we might not want our children to do something that other kids are doing, or our choice for our child may not be the popular decision among the other kids and may not feel like what your child wants, but is something that we are doing because of our own beliefs. I think that if your child is old enough that you can talk to them about it, you can express your own reasons, right? If you are choosing not to send your child to camp, I'm sure it was a thoughtful decision and you have your reasons. And you can talk about how every family decides things differently, and especially with COVID, that right now we don't have all the answers. And so each family is having to make a decision for themselves. And I think being honest about that is important. And again, I think you as a parent, this is just really good practice for what will likely be many years of instances where you might have your child do something that they don't want to do, or aren't letting your child do something that all their friends are doing.
Dr. Lupu, anything to add there?
I really echo everything that Dr. Shale is mentioning. Trying to have that open conversation with the kids who are old enough to understand, I think, is a really important point.
Okay, great, thank you. Dr. Lupu, I have a couple of questions for you here. With regards to social distancing, the first is it safe to have another family over for a barbecue and not enforce social distancing for the kids? And also, what are your thoughts on instructional swim? Is it safe, obviously, because there is minimal distance between the child and the instructor, and especially for the little kids?
So I'll tackle the first one first, and it's a very difficult one and sort of echoes back to what I had spoken about in my talk at the beginning, is that that's a very individual choice for everybody. It depends on what family you're seeing, how they've been quarantining, what the underlying health issues are for you and your family and anyone that you see. But another pediatrician that I follow said it best, is your bubble is only as good as everybody in it. So, You just want to make that informed decision before you have those play dates. Kids really can't stay away from each other, as everybody knows. So you want to just weigh the risks and benefits. In terms of instructional swim, it's a little bit the same, although if it's a one-on-one situation, the risk is obviously much less. But I would have to assume if it's instructional swim, then that instructor, unless it's a family member, probably is teaching lots of other kids as well. And generally, when you're in the pool, while the water does not seem to be a big transmitter of the COVID virus, being in close proximity above water is similar as to being in close proximity on the ground. So you're not going to be able to keep your kid away from the instructor. So it's one of those risk-benefit analyses as well for most parents.
Okay. And it seems like we had another similar question that I can probably tie into this. What are your thoughts with children getting together outside for small activities in order to provide them with socialization, especially in instances where they might not be going to camp? It seems like the advice would be pretty consistent with what you had just said.
Right, but I do think that there is the opportunity to have some social distancing activities. You can do outdoor movie nights if someone has a projector and you guys sit far apart and bring your own popcorn. I think that's a great thing to do if kids are awake past daylight hours. Or just doing, on the grass hangouts where you guys are more than 6 feet apart and wearing masks. But again, that's very difficult to enforce and it's not zero risk. So everybody has to make it at their own discretion.
Okay, great. Thank you. Another question that's come in: ever since being quarantined, my daughter is very angry and will just scream and talk back. Any tips on how to manage this behavior? Dr. Shale, why don't you start with this one?
Yeah, this is a really, really hard one because we want to validate that our children are definitely stressed out by everything that's going on, and we don't want to minimize what they're going through, but we also don't want to make allowances for their behavior and say, well, they're only doing this because of COVID, right? We don't want a time when they're stressed for them to think they can just scream or kick or have these types of fits. So a couple of things that are really helpful with anything with emotion regulation is helping our kids to label their feelings. So we can do that by guessing what they're feeling, putting a label on it, let them correct us. No, that's not what I'm feeling, I'm this. Labeling our own feelings, especially those negative feelings, modeling for them how we handle those emotions. And really, if you can spend time practicing ways to calm down when your children are already calm. So doing something like bubble breathing, where you're taking those good breaths, where your belly fills up and you would be blowing out birthday candles or blowing bubbles or blowing a pinwheel. It's really helpful if you can practice those things at a time like before bed where they are already calm, so that when they are in that moment, they're more likely to be able to generalize those skills. Keeping a list of coping skills and ways to calm down is also helpful. A lot of kids will say, in the moment, I'm so mad, I can't think of what to do. So if you can point them to a list or do something with them, it can often help. And again, when kids are then calmer, really trying to encourage them to talk to you about what they're feeling, and validating that you likely are feeling a lot of the same feelings that they are too.
Great question. We have time for a couple more. This is an interesting question with regards to the transitions that children will be going through as they potentially re-enter a daycare setting, or if parents are just deciding to make the transition to different care providers as a result of concerns with health or whatnot. This particular question, parents switching their 2-year-old child from daycare to nanny, and they'd like to have a sense of how they can potentially ease that transitional impact on them.
Dr. Luper, I can go for it.
I can start a little bit.
Okay.
So a lot of it depends on the age of the child, I believe. If it's a younger child, obviously there's not really much discussion. It just happens, but they're going to be missing a lot of that social aspect and a lot of those other external stimuli that they were seeing before. So by trying to encourage the nanny to do outdoor activities and keep them entertained, I think that would be a very good way to do it. For an older child that you can talk to, I think it's similar to the day camp and the question that we had earlier, that you just want to have this sort of discussion, and Dr. Shale can speak more to this, but discussion with them why right now this is the best decision for the family. And while it's going to be a difficult decision and a difficult transition, most kids generally tend to do okay.
Yeah, I agree with Dr. Lupu said. I think a 2-year-old will probably handle it okay. You as parent might be sad to say goodbye to those daycare providers, and a lot of times our own anxiety as parents is more of what we're feeling than what our children are actually feeling in a situation like that. Again, I think the question that still kind of lingers around this is, if your child hasn't been in daycare for the past several months, obviously there's much less of a transition. If your child's leaving daycare on Friday and starting with a nanny on Monday, that might just kind of shock them a little bit more. But again, at 2 years old, they'll probably go right into it, especially if the nanny is coming into your home and they're with all their usual comforts. So I wouldn't stress too much about a 2-year-old because they are usually super resilient and able to kind of go with that stuff, especially if they're going to still be in a really happy and positive place.
And I would agree. Excellent answers. Thank you. Like I said, a couple more questions. What are your thoughts, and this question would be for both doctors here, what are your thoughts on how much structured versus unstructured time should parents be thinking about this summer for kids based on their age? So what would you expect for maybe a child who's in early elementary, 6 to 7 years old, as opposed to a 12 or 13-year-old?
I can start on this one, Dr. Lupo, if you want. I think I'm getting a lot of questions about this too, structured and unstructured, and unfortunately there just isn't really one good answer. I think it really depends on what structured time looks like in your house and what unstructured time looks like in your house. So if unstructured time is staring at an iPad, you are probably going to want less of that, right? If unstructured time is playing outside or doing art or listening to music or reading or playing board games, then you can probably have a lot more of that. I think it really ends up being just about balance. So right now, kind of before summer, a lot of people are having their structured time around school and then really leaving the rest of the time unstructured. However you set it up though, again, you just really need to be realistic. If your kid's a little bit older, you can have them kind of earn certain amounts of time. If they do 30 minutes of one thing, they can earn 30 minutes of screens or things like that. 30 minutes of chores gets 30 minutes of screens. So there's definitely ways that you can balance it. I also think it's really helpful, although it is a little bit heavy on the front end, is if you and your children can make lists of things that they can do. So many kids right now are saying they just can't, they don't know what to do. They're so bored, even though they've got lots of things to do. So sometimes it's helpful to just, again, try to keep a list and point them to the list if they're struggling, and encouraging them to try 2 things before they come back and ask for another suggestion.
Dr. Lupu, any comments?
I usually go to Dr. Shale for questions like these for myself. So
Me too.
I will leave
Okay.
that.
All right, sounds good. It's an interesting question, and this will probably be the last one that we will address tonight. How should we think about and begin to talk to our children about returning to daycare and school in the fall, considering we expect to see, a considerable amount of differences, from the moment children are dropped off, perhaps even bussed in, and then, differences in the classroom from when they were last there in March?
So I'll start a little bit with this, just because I have been getting a lot of questions from parents about what school is going to look like. And while we don't know that yet, because we don't know yet what's going to happen, we do know for sure that there's going to be a greater focus on monitoring of symptoms and hygiene. So what I've been telling parents is try to mimic this at home to start with, because then the kids won't be as surprised when they get to school. That might not mean, forehead temperatures every morning, but definitely making sure that they're washing their hands before and after meals. If they've been playing with something and they move into a different activity, getting them used to washing their hands. And, a lot of people ask about masks, and pediatricians are very split about whether masks in younger kids are helpful or not, just because, as you can imagine, kids just touch their face all the time. I see it all the time in my office. But if if it comes to the point that kids are going to be asked to be wearing masks at school, I would recommend practicing at home just so they get used to the activity. So they're not touching their face so much. What I usually tell my patients is at the beginning, I couldn't wait to get my mask off. And now I find myself halfway into my drive home with my mask still on. And I'm one of those people that everybody makes fun of. So you really do get used to it. So I think practicing at home is going to be the biggest thing. And then just letting them know that things are going to be a little bit different and these are the reasons why. And if they're more aware about them, it's going to be less of a shock and more of a, oh, mommy said that and that actually is happening, and let's go for that.
Yeah, and kind of just, just expanding on that a little bit, well, first of all, a great tip, I think, about getting kids to practice like way more hand washing than they're probably used to. So I love that one. And I'm definitely going to be sharing that with families and in my own house. But I think also we really want to make sure we have the information before we start to talk to our kids about it. So if you say really broadly that there's going to be changes, a lot of kids are going to say, like what? And if you say, I don't know, that may lead to some undue anxiety about it. So it would be really ideal if you wait until schools have their plans, even if that ends up being in August. You can be honest with your kids that they're trying to figure it out. They want it to be a safe place. We don't know what the differences are going to be yet, but they will have time to know about it and hear about it. It won't be just walking in on the first day and everyone will be surprised. We'll have that information before and we can all plan and prepare together. So I don't think it needs to be a conversation right now because sometimes too much time gives kids too much time to worry and come up with scenarios in their head where I think the reality of it may not be as scary for them, again, as it might be for us. So I would give it some time and wait till we have more information so that we can really answer all their questions.
Great responses. Well, that wraps up the question and answer portion of the event. So I will turn it over to Maren now for concluding remarks.
Thank you so much, Dr. Shale and Lupu and DiGaetano. Thank you for being with us this evening and the generosity of your time and your knowledge. As the mother of a toddler who's turning 18 months this week, I really did appreciate all of this and it resonated with me. Thanks for joining us, everybody. And if anyone is interested in supporting more programs like this, please feel free to make a donation to Jewish Federation. And if anyone would like to find out how to get in touch with our presenters, feel free to contact me and I can put you in touch with them. Thank you, be safe, be well, and we hope to see you on Zoom or in person again soon.